And I guess the next speaker is Chris.
Yep. Thank you, Dr. Serwer. Hi, I'm Chris Melo from Philips Healthcare, and currently one of the technical co-chairs of the IT Cardiology Domain. I'd like to provide a brief overview of some of the main areas related to workflow that the IT Cardiology Domain has been focused on to address some of the needs that Dr. Serwer had just identified. It's widely recognized that cardiac imaging procedures are often complex. For instance, evidence gathering activities may begin before an order is placed. Orders are often not created for cardiac procedures in emergency cases. And there may be imaging, measurement, and reporting systems that need to coordinate to use the same patient identifier and to ensure that all the evidence produced is all associated with the same procedure. Additionally, cath procedures may include both diagnostic, interventional, or therapeutic aspects, and often extend over a long period of time. And there's also the issue of frequently having intermittently connected modality devices on the network, such as portable echo machines. So IT Cardiology has defined workflow integration profiles specifically for several key cardiac procedures and exam types, including cardiac catheterization workflow, echocardiography workflow, and cardiac stress test workflow, where both ECG and imaging are included in there. And we've also focused in on supporting intravascular imaging exams as unscheduled imaging in conjunction with an ordered or scheduled procedure or imaging exam. We've taken a common approach for all these workflows that includes a consistent handling of patient identifiers and demographic data, having the scheduling and coordination of procedure data across a variety of imaging, measurement, and analysis systems, and it includes reliable storage of all the data collected in an archive from where it is available to support subsequent workflow steps, such as for reporting. And these workflows include providing a central coordination of completion status of steps of potentially multi-phase, for instance, diagnostic and interventional procedure, or a multi-stage exam such as stress echo exam. The main clinical use cases supported include the typical case where a patient registered exams ordered, but also extend to emergency cases, situations in which patient information is updated to the procedure, procedures canceled. Also includes the creation of evidence that could be included post-procedure or even during the procedures. And some of the more complex scenarios where you have intermittently connected modalities. Some of the key clinical benefits of these profiles include providing a consistency across workflow in the cardiac care settings, for instance, across cath lab, echo lab, and stress lab, focusing on the patient demographics accuracy downstream so as to minimize errors in manual reentry of data, and also the handling of exceptions to standard workflow automatically as part of the workflow. The workflow profiles themselves involve interoperability of multiple systems, including the ADT system or hospital information system, cardiovascular information systems, PACS, imaging and waveform modalities, as well as imaging analysis and reporting workstations. And in doing so, we've actually been leveraging base interoperability standards, including HL7 for patient registration, for order placing and order scheduling, and also DICOM for maintaining consistency of patient demographic and ordering information via modality work lists, and also for conveying status from modality to the different other systems involved about the procedure, exam, and acquisition. Next slide, please. Resting electrocardiograms are a widely prescribed diagnostic test in cardiology, and currently workflows have been based on proprietary communications protocols, which often hamper interoperability. So IT Cardiology has defined two profiles specifically to address the workflow for digital electrocardiographies. The first profile is the resting ECG workflow profile, and this is leveraging the work in the cath and echo workflow integration profiles and supports handling of patient identifiers, ordering, scheduling, status reporting, and data storage. And it also addresses the need, additionally for ECGs, of having intimately connected acquisition modalities to the network. And this will handle unordered tests, also when you have urgent ECG tests, and also ECGs when they're acquired in both the hospital and office settings. This profile, resting ECG workflow profile, leverages HL7 and DICOM as well, similar to what it's used for the other cardiac workflow profiles. And the ECG waveforms and measurements and interpretations are all stored in DICOM format, so they can be accessed and stored along with other imaging studies in the same enterprise systems. And the second profile is the Retrieve ECG for Display profile. This provides access throughout the enterprise to ECG documents for review purposes. And there are several scenarios in which a cardiologist may need to retrieve and review the ECG data, as in preparation for a CAT procedure or in order to compare with the previous ECG performed elsewhere. Historically, this has happened by obtaining a copy of the paper-based record, but now this profile allows for the selection, retrieval, and display of ECG data on the same display system the cardiologist is working on, using the same patient context, providing all the relevant information about the ECG. And the display system could be either an EHR system, a CAT or echo workstation, or a CVS system, or some other web-based display application. These profiles enable consistent workflow for ECGs similar to the workflows defined for other cardiac imaging procedures and exams, and leverages those standard cardiac workflow models we described in the previous slide. Next slide, please. Another area of focus is around reporting, and reporting is key to support the downstream use of clinical information obtained during the exams or procedures. Cardiology reports typically include lots of graphics and often many measurements and observations, and often really complex sets of results. In IHE, there's a consistent way to manage the imaging reporting workflow, focusing on the worklist management and workflow report states. This is based on reporting workflow profile from the radiology domain, but it can be leveraged here specifically for the cardiology procedures. IHE Cardiology has also created a displayable reports profile focusing on the creation, revision, transmission, and reading of display-ready reports. And since there's a lot of graphics and other information in there, that's really important. This cardiology-specific profile supports PDF as well as CDA documents using HL7.2 messaging for exchange of those reports. The capture of cardiology-specific content as DICOM structured reporting evidence to be included in clinical reports is defined based as a specialization on the evidence document profile from radiology. So we've extended it in order to support the cardiac-specific content. Other specific cardiology content profiles have also been developed, and you'll hear more about these in the next section of this webinar. So we've focused on workflow between a reporting application and the departmental information system, and/or an EMR, EHR. And this allows report archiving to a PACS in the local environment, or also to an enterprise report repository. This standardizing and reporting workflow we've done in this area, we've done some work, but we also see this as an area for further focus, especially in the area of electrophysiology procedures and the workflow related to generating those reports. Next slide, please. So beyond the care settings in the hospital and in the cardiology labs, we've also begun to focus on expanding to other care settings, and specifically to the office or ambulatory setting. The goal of this Imaging-Enabled Office effort is to integrate an imaging suite with an EHR system in an ambulatory office setting, including ordering, imaging acquisition, report creation, and web-based imaging exam review of diagnostic images. and it includes a bidirectional integration of medical imaging equipment and the office EMR. It's focused on cardiology, but it's not limited to cardiology and could apply as well to other ologies, including orthopedics, women's health, and even primary care. Because from a PACS and imaging device perspective, this facilitates the adoption of IHE in the office environments because the imaging assets can be deployed with almost no changes. The focus here is less up on the upfront order placer communication and more on the filling of the exam orders. So it actually combines what's typically the admission discharge transfer actor and the department system scheduler into an integrated actor so that these can be implemented by an integrated EHR system without having to expose those internal order transactions. The focus is really on the acquisition of the imaging with the imaging equipment. And these use cases include where there's explicitly ordered consultation or specific diagnostic exam, unordered exams, as well as imaging analysis reporting at the imaging workstation, everything within the office domain. Next slide, please. So this is a list of the profiles that we have discussed in these past few slides. At the top, there's a link to more information on each of these profiles. Some of them are in final text, and the rest are available for trial implementations, meaning they can be tested at Connectathons still. And note also that this list does not include the content profiles. Those will be addressed in the next section of this presentation. Next slide, please. So in the cardiology world, we leverage a lot of interoperability standards, and we're not, instead of reinventing new standards for our cardiology-specific needs, we're trying to leverage as much as possible and contribute to the work done in other complementary areas, including both in the IHE domain space as well as in other interoperability standards initiatives. So on the right-hand side, you see that we are leveraging other profiles used in the 4 domains. In IT infrastructure, we apply many of these profiles to the cardiology environment, for instance, for audit event login node authentication, as well as for network exchange of reports. From the radiology domain, we're leveraging basic workflows and specializing them with extensions for cardiology-specific needs, including the scheduled workflow, reporting workflow, as well as the XDSI for exchange of network exchange of images. And in the patient care coordination domain, which focuses on care coordination, we've actually been coordinating with them, as Dr. Serwer said, to focus in on some specific areas, such as related to cross-enterprise cardiovascular heart team workflow definition for orchestrating dynamic network of cardiac professionals, as well as a more recent effort in creating bindings between implantable medical devices and their patients and the clinical procedures. And of course, in the PCD domain, we're leveraging the work in cardiac device communication, especially in the area of implantable cardiac devices. On the left-hand side are some of the interoperability standards that we leverage extensively within our profiles. Of course, from HL7, we're leveraging HL7 version 2 messaging, the clinical document architecture and consolidated clinical document architecture, as we hear more about. And also we're looking to leverage FHIR going forward as that becomes more widely used in the industry going forward. DICOM's another one of the base standards that we leverage extensively for imaging communication. We leverage the base standard and as well as the RESTful interfaces and the definitions for mapping that to HL7. And underlying all this is the use of standardized nomenclatures, and we make extensive use of LOINC, SNOMED, as well as IEEE 11073 medical device nomenclature within our profiles.